Hi everyone, you're listening to Let's Psyconnect. This is LT, and you can also watch today's episode on the Instagram page as well as YouTube page. But if you don't know how to get to them, go to letspsyconnect.com, go to podcast episodes page, and scroll through the list of podcast episodes, and you're gonna find chronic pain and mental health. But if you still want to go to Instagram page and stay Psyconnected with me, go to my handle, which is Let's Psyconnect. So today I'm going to be talking about chronic pain and mental health, like I alluded to. It's a topic that I'm very passionate about, and I want to help raise awareness on this topic, right, on this condition that's affecting millions of people around the world and in the United States. And it leads people to go to their medical providers, right, to their physicians very often, but not so often to their mental health professionals or mental health professionals in general. But hopefully by raising awareness, we mental health professionals can also help educate the population and bring attention to the importance of providing mental health treatment to those experiencing chronic pain, and help them achieve a quality of life that is that they are looking for, right? So let's talk about it. I'm going to go over the definition of chronic pain, of pain in general, and also talk about the Biopsychosocial Model, a theory of pain. And I'm going to talk about the cycle of pain and some of the factors that I have shown to be influenced or to be associated with chronic pain. But I'm actually going to go more in depth on the topics associated with chronic pain in the next episode. So stay connected for more. All right. And I'm not an expert in chronic pain. I have spent quite some time talking about chronic pain, reading about chronic pain, and writing about chronic pain in my schoolwork and whatnot, but I'm not an expert. There's a lot more for me to learn, and I like to do research involving the subject of chronic pain. But the little that I've learned so far, I would like to share with you. If you do catch something that I say that it's not appropriate or incorrect, please let me know. And if you do want to know more about a given subject associated with chronic pain, send an email to discussion@letspsyconnect.com. So let's get started. So non-malignant chronic pain is defined as pain that usually lasts beyond the time that is expected to heal and or despite treatment, with a duration of at least 3 months. So something happened, or you experience pain, and it's telling that there's something going on, and there is a time that it's expected to heal, right? You broke your arm, for instance, and then the doctor says, oh, in about a certain number of months, it is expected to recover. And then let's say that time has gone by and you experience that pain, even though the x-rays show that it's completely healed in terms of bone structure and whatnot. And you have received the treatment, but you're still experiencing pain. There's no alleviation of pain when it comes to that, and has gone beyond at least 3 months. And it's one of the most prevalent and reported medical conditions in the United States and around the world, leading to disability. And in the United States, there are about 26 million adults suffer from chronic pain. But let's not forget, children and teenagers, adolescents also experience chronic pain. All right, but my research, my reading has focused more on adults. So that's what I'm going to be talking the most throughout this the series of episodes on chronic pain and mental health. But keeping in mind that yes, children and teenagers experiencing chronic pain, they're suffering from it for many reasons, and it's important to give attention to that as well. Okay, and the number that I mentioned, 26 million, it's something that has been reported in 2015, but the number has increased, or I believe it has increased since then, not only in the United States, but around the world. And there are many chronic pain conditions, or non-malignant chronic pain conditions, I should say. So I'm going to be saying chronic pain condition or chronic pain, but whenever I'm referring to chronic pain here, it means that it's non-malignant chronic pain. I just want to put that out there too. So some of the conditions are fibromyalgia, temporomandibular disorders, so here around your jaw area, headaches, back pain, arthritis, And there are a lot of times when individuals say that they have been diagnosed with more than one chronic pain conditions, right? So there's their concurrent conditions. So one might have low back pain and headache. And although chronic pain conditions are associated with or the result of an accident or an injury, right? So that would be the cause or potential cause of, or it explains why someone is experiencing chronic pain. The causes of many of these conditions have not been identified, which is something that patients or providers, they say that it's very difficult to treat chronic pain or that given chronic pain condition because they don't know what's really causing it, and they don't know what's really going to influence the changes in that pain experience. Moreover, some chronic pain conditions are experienced as recurrent and others as constant pain. I mentioned I was going to talk about the model, the biopsychosocial model here, and I want to differentiate the biopsychosocial model from the biomedical model. The biomedical model is the more traditional model that medical providers tend to rely on. And not to say that some medical providers are not now relying on biopsychosocial model. It's just that it's something that's it's the more traditional model that has influenced treatment approach given to individuals with chronic pain. So let's say a given treatment approach would be surgery or medication because of the changes in physiology or the biology of the human being, right? Because of the belief that that the cause of a pain is some physiological change or biological process, right? Or it was something like the bone broke or something else. So they will do a certain type of treatment to like a surgery to treat that given condition or what is causing that pain. Whereas the biopsychosocial model, it starts to bring attention to other factors beyond the biological or physiological processes that might influence one's condition, right? Just like the name says, so it's biological, psychological factors and social factors. But if you go beyond, you can also add the spiritual factors that can influence one's condition. It's not just pain, but other conditions as well. And with that, it's going to influence the treatment approach provided to that individual in the case. So there are different theories out there explaining the development of chronic pain and whatnot. One is the specificity theory of pain by von Frey. The other one that is often talked about is the gate control theory by Ronald Melzack and Patrick Wall. I'm not going to go in depth into this, but I'm just going to make a reference to it because it's important in the field, and also because it's often talked about in the protocol for CBT, so cognitive behavioral therapy for chronic pain. So some of you might actually know about it, but others, I do encourage you to do some more reading about it. But in summary, the theory suggests that the pain signals are modulated by gates that open and close, affecting one's pain experiences. So gates will open pending like number of activities of pain fibers, and closing pending the number of activities of peripheral fibers. And as a result, it opens and closes the gates, affecting the pain experience. So if you are taking a medication, to some people, it might mean that the gate is closing because it's providing alleviation of pain. To some people, it can actually increase the pain. So that means the gate is opening or it's open. Same thing for exercise. It can open and close the gate. If you are pushing yourself and doing it in a way that, pacing yourself and it's not adaptive for your body, then it can actually be detrimental to your pain experience, meaning that it's going to open the gate. But if you're doing it in a way that it can actually facilitate the improvement of that pain experience, then it's closing that gate, and so on and so forth. So there are other variables too that influence the opening and close of the gate, including how we think of our pain experience and whatnot. So remember, the gate control theory, okay? The other things that I want to talk to you about is here. So putting the theory together with the biopsychosocial model. So basically, it's important for us to consider that chronic pain is influenced by psychological, so physiological, social, and emotional factors. So one's anatomy, our physiology, genetic predisposition, right? But beyond that, some of the other variables that I mentioned. So it'll be emotion and affect. So depression, anxiety, fear. So cognitive factors such as appraisal, self-efficacy, resiliency. Our beliefs can influence one pain's perception and experiences. So the way that we learn about pain through like cultural beliefs or cultural environment, right? The way that our parents or society has taught us to see pain can influence our pain perception and experience. And our past pain experiences can also influence new and current pain or our chronic pain experience. So for instance, if you, let's say you go on this walk and then you hurt your foot, and then your brain is scanning for the environment, right? So to know where it happened, how it happened. And so if you go in a future walk and your brain has scanned the environment and it sees similar triggers or similar factors that to that previous experience, it can start triggering your brain or your body to that pain experience. And some people say that they start feeling pain again, or they actually, let's say they hurt their foot, but because of the pain experiences now, let's say before they experienced pain at a level of 5, and now they experience the pain at a level of 8. So our past pain experiences can influence our current experiences. And also, if you sometimes like listen to other people's experience of pain, like how they hurt themselves or whatever it is that they reporting as pain or causing the pain, it can trigger inside of us, right? Similar changes or physiological changes that can simulate pain. And some people say that, oh, I'm actually experiencing pain, or I can imagine that pain because of the way I felt in the past. So keep that in mind. You know, there's so many factors that can influence the development and maintenance of chronic pain. And with that, the biopsychosocial model is the model now that it's recommended basically to use when conceptualizing and seeking to have an understanding of one's chronic pain experience. Now I want to talk about the cycle of pain. I did not write it about it. I learned about it when I was reading the different research articles. So I was actually reading the Simons, Elman, and Borsuk. I might have mispronounced their names. This article came out in 2013, and it summarized the cycle of pain, and I'm going to do a summary as well. So thinking about, okay, so when one is experiencing pain, or think about when you experienced pain before, are you more likely or less likely to then engage in some type of physical activity? A lot of people say they're less likely because they want to rest because they're experiencing pain. So they're withdrawing from physical activities. And it's not just exercise, you know, it can be like running to the grocery store or doing some type of physical movement that they believe that is going to actually make their pain worse. And associated with that is the negative thoughts and emotions that have been triggered by not only the pain, but also from withdrawing from the physical activities. And that can also lead to the loss of social support or preserve the loss of social support. And because you're not doing anything physically or doing things physically less often, it can lead to a loss of physical strength, which then leads to the maintenance of pain or increase of pain. So it creates a cycle, and treatment should address that cycle, or meaning those factors influencing the maintenance of pain, which goes back to the biopsychosocial psychosocial model, because here we're talking about a behavior factors that influence the pain. We're also talking about cognitive and affective factors that influence chronic pain. And we're talking about biological, like loss of physical strength, and also loss of social support, so the social factors do. And social factors, we can also talk about employment history, or if, like, let's say they don't see themselves as being productive anymore, they can no longer work. So it's influencing the social environment and the sense of productivity, right? Or the cognition associated with the employment status. So it's all associated. And treatment then should seek to improve pain in the areas affected as a result of the pain experience, including, like I said, the behaviors that have been avoided, the cognitive factors that may be negatively interfering with the individual's treatment progress. And the ultimate goal is to increase functionality, right? It can be physical ability, social interaction, and it might mean that one is to exercise or do physical activities that they've been avoiding, get them connected with physical therapists or other professionals that can help improve physical functionality, and also work on the cognitive factors and affective factors. And with that, you can probably imagine here, if I'm using this language here, that one of the treatment approaches recommended for chronic pain is CBT, so cognitive behavioral therapy for chronic pain. There are other modalities too, such as mindfulness-based ACT, so acceptance committed therapy. Sometimes they do a combination of different therapy or treatment approaches as well. There are different protocols out there already available for mental health professionals and beyond. And the research is often studying them and looking at them. If it's like a long, not even long, right? It's known as brief. It's 12 sessions. If it's going to be 6 sessions, one workshop and one not. So stay tuned with research as well, because it's something that research is often looking at. Because the goal is to continue to improve one's functionality and one's experience. Because, like I said, chronic pain can affect multiple areas of one's life, and it can be very detrimental to one's sense of well-being. So healthcare professionals with that approach, they rely less on pain medication management, or pair that with other forms of treatment. Like I mentioned, the physical therapy, psychotherapy, massage, yoga, Tai Chi, and other modalities as well. And we are gaining more awareness that medication, it's not something that is actually leading to improvement. And patients are now saying, like, I want something else. This is not working for me. And also because, and importantly, because of the opioid crisis, it's well known that other modalities, other treatment modalities are very much needed to help those individuals or assist those individuals suffering from chronic pain. So this is it for today's episode. I hope it gave you some information on chronic pain and mental health awareness. Stay Psyconnected, because I'm going to bring you even more information so you can learn more about the possible variables that are associated with chronic pain, and what do they mean in terms of treatment. And so yeah, can't wait to come back. So stay Psyconnected. I am on Instagram as well as Facebook and YouTube. And remember, let's Psyconnect.